we know modern cosmetic dentistry does more than improve your looks. Procedures like veneers, clear aligners, dental implants, they can strengthen the enamel and correct some bite issues. And of course, boosting self confidence and your self esteem. So joining us right now is renowned Beverly Hills cosmetic dentist, Dr. Sep Pouresa. Good morning, doctor. Thanks for joining us. And you have such a great smile, you know? I mean, talk the talk, you got to smile the smile. Dr. Pouresa, walk us through this connection between the smile and overall health.
Right. So to me, a smile is more than just teeth, right? It's one of the first things that people notice before you even speak, right? So think about the time where you're in a meeting, out with friends, or even on a date, right? So oftentimes you're not going to remember what was said, but you're going to remember how you felt. And I feel like with a smile, it's a way of expression and it's contagious. And the amount of energy you can exude with a good smile is just so contagious. And it really is a great way to boost confidence.
Yeah, I mean, almost the smile walks in first before the person, right? Uh,
Exactly.
so, what is the most popular procedure that people get these days?
Yeah, so when people think smile makeover, they think veneers. But the truth is, there are plenty of other options as well, anywhere from whitening to clear aligners, like you've mentioned, implants. But for those who are interested in veneers, it's really important to sit down with your dentist and ask questions. See what your expectations, your goals are, and you might find out that there are other options as well, right?
Absolutely. Why does a good smile, a cosmetic smile, then, or enhanced smile, improve overall health? How does that work?
Right. So teeth and gum, there's also a very strong association between what goes on in the mouth and what goes on in the body as well. So there are a lot of literature that shows that people who have gum disease or a lot of inflammation at the level of the oral biome are also have inflammation in other places in their body as well and could be associated with diabetes, heart disease, because of the fact that bacteria can enter the bloodstream. So there's a very important correlation between what goes on in the mouth, but also what goes on in the body, right? So it's beyond just aesthetics.
Yeah, I mean, but we do know that cosmetic dentistry or any cosmetic procedure sounds expensive. Many times people have to really put life savings away to take care of things like that.
Yeah, so cosmetic dentistry itself is an investment, but it's important to understand that it's not just veneers, right? There are other options out there as well. Anywhere from whitening to clear aligners, even maybe a little bit of bonding to add length in certain areas. So when people think aesthetics, I don't want their minds to wander off just to crowns, veneers, bridges, right? And that's why it's so important to really sit down and talk about your expectations and goals. And there are other ways where we can tailor it to your needs as well.
How can a smile makeover, how long does that take? And is it painful at all?
So the process itself is very simple, right? I like to divide these into 3 or 4 appointments, with the first one taking the time to really sit down and listen to the patient, see what is it that they want. And I love taking x-rays, photographs, picture after picture, because when it comes to designing someone's smile or someone's teeth, it's not just the teeth. We're looking at the eyes, we're looking at the jaw, we're looking at the lips. I'm even looking at personality. The more feminine or softer someone is, the more rounder I like to make them, and the more aggressive someone is, the more sharper and square I like to make them. So the first appointment is really to sit down and see what is it that the person wants. Now, once that's done, then we have them come back where we do the preparations and take imprints and put them on a temporary. With the temporary, they will be able to try them out for a week or two, make sure they like them. And if they like them, then I'll ask my ceramics to duplicate them. The whole thing is painless, right? We numb you really, really well. We make sure everything is very comfortable. Sure, sometimes you might experience some mild sensitivity, but it shouldn't be painful.
Yeah. So, for anyone who is watching right now, wants a healthier, a more confident smile, where should they start, especially if they're on a tight budget?
Yeah, so I would always recommend doing a lot of research, right? Seeing what alternatives are there. Speak with your dentist. And remember, different dentists use different ceramists. See their work, see their previous work, see the pros and cons of each one, and see what you feel most comfortable with. I think the best outcomes are always done when you connect with your dentist, right? When you sit down, when you listen to your expectations, your goals. So, for anyone who's really interested in seeking dental aesthetics or a smile makeover, it's really important to take the time, do a lot of research. I have a lot of great information on my website as well on drspuresa.com. So, just take the time to really do the research before you commit into something.
All right. Very good information there. I, many years ago, did the Invisalign. I had like the slightest overbite and I had TMJ. I took care of the TMJ separately, but I still wear that last retainer, yeah, as a retainer, like once or twice a week just to keep them straight. So the smile is so
Good.
important.
Yeah, I love that because maintenance is so important, especially when it comes to Invisalign, like you've mentioned, or even veneers. People ask, how long does it last? And the truth is, it depends on, are you still taking care of it? Are you brushing? Are you flossing? Are you wear your aligner? And if you are, it can last you years and years and years. So I'm glad that you brought that up.
Yeah, I mean, if you make that investment, you would hate to throw it all away after
I
3 to 5
hope so.
years. All right.
Hope so.
Dr. Sep Pouresa, thank you so much for that information. It is important to have a good old smile. Thanks, doctor. Keep smiling.
Thank you.